Hi guys, good evening. I hope everyone is doing well, and I hope all the best for those who are sitting in January. And I wish you guys, all of you, clear pass in the exams this week and February and March and every exam. Tonight we'll just discuss about few tips about the exam, guys, and we're still getting too much text about how you should organize your whiteboard and what is the best thing that you can write on the whiteboard. And the answer for this, it depends on you. I will give you what I have done. I will give you what the structure I have used in my whiteboard, and then we'll show you the size of the whiteboard I did use, plus some tips for the exam. After we finish the tips, probably I will tell you some few things about one or two cases that we have discussed before. So this is the final tips before the exam. Usually, guys, this is what you should be doing the week before the exam. Okay. For those who are sitting for January, you probably can apply some of this. And for those who are still preparing for February, try to do all of that before your exam. So the week before the exam, let's say you are starting your exam on Tuesday. So the week before that, 7 days ahead, you should revise all the management plan or the history taking in this week. You should revise all the topics or the flashcards that we have made in this week. And you need to sit on your chair every day for at least 4 to 5 hours. Not less than 4 hours. Not less than 4 hours. The more the better. I used to sit down on my chair every day for more than even 8 hours, sitting on the chair just to adapt my body and like accommodate this position sitting on your chair for the exam. And in my exam, I was sitting on my chair for about 4.5 hours after the ID check, and then after I finished my exam, I was still sitting on my chair for about 40 minutes or 45 minutes. So you need to adapt your body to sit for long hours, and you need to revise your all weak point. And you know your weak point. Okay, you know the topic that you when you were practicing, you done it really well. You were not aware of the management plan. You didn't know what the exact questions you need to ask. All of that. That's why you should have a note while you are practicing, and you need to write in every note what was your cases that you struggled with. Okay, so revise all your weak point and topics before the exam. And I advise you guys, try to practice a couple of cases at the night before the exam. So the day before the exam, for example, who are going for the exam on Tuesday, try to practice at least 1 or 2 cases the day before. Why? Because you need to be in the exam mood. You need to be in the exam mood, and you need to make your tongue very fluent when you are asking the questions, asking about eyes, all of that, because this is ability that you adapted and you get it by practice. So even until the exam or the day before the exam, try to practice on a couple of cases. I did 4 cases the night before my exam with my study partner, and I finished by about 7 or 8 p.m. So try to finish maximum by 8 p.m. Okay, because last few hours it will not add anything. You just need to relax your mind. You need to have a good sleep at night as well, especially for those who are going in the morning, in the AM. So try to finish everything by 8 p.m. Go to your bed and have a nice sleep, probably around 9 or 10 p.m. So how to set up your exam environment, guys? Again, it is very important. It's very, very important. And who didn't do that before, try to arrive early on the day of the exam by 1.5 hour, 1 hour to 1.5 hour, because you need to set up your environment. Very, very important. You need to only one screen for the computer. My room had 2 screens, so I had to unplug one screen and I had to turn it other way around and cover it as well. So if you have 2 screens, you need to unplug one screen. Only one screen they allow it in the exam. And you need to check the IT system. You need to check the internet connection. You need to check the IT system. I know all of you guys should have the email. You need to check the IT system and the software. Okay, try to do that again before the exam. In the hour before the exam, try to go tomorrow or day after and try the link again that they have sent it to you. Cam and mic, yes, you need to check them very carefully. The cam and mic. My PC sound was very awful. That's why I had to use mic. So I was wearing headphones. And while I was practicing, even I was wearing the headphones every day in the last 2 weeks. Again, to adapt that I'm wearing headphones on my head, because this is something I don't do usually. Very rarely to use headphones. So try to check your cam and mic, make sure they are working. All the wall posters, you need to cover them. All the wall posters, you need to cover them. My advice, don't remove them, because anyway, you will put them back. Just with paper sheet, from that paper sheet, you just cut some like paper sheet and just cover the wall posters. And then fire alarm is very important. Fire alarm is very important. Okay. So try to tell your practice manager and the staff, please don't turn on the fire alarm in our practice. Every week we are having fire alarm day. Usually it is on Tuesday. So try to ask the practice manager, please don't do the fire alarm on the day that you are having your exam. Very important. You don't need any disturbance while you are taking the exam. And the door, make sure the doors are very closed, well closed. Block them from inside and put a note on the outside that exam in progress. Please don't disturb or don't enter the room. Coffee and water, you are allowed to have one drink with you. Okay. And please, my advice, don't drink too much coffee in the day before the exam. I mean, in the early morning, when you wake up in the morning, don't drink too much coffee, because anyway, one coffee for you is enough. If you drink like couple of coffee or 3 cups of coffee, because many people used to do that, and one of them, you will struggle in the exam. You need to go to the toilet many times to wee. So 1 espresso or double espresso is enough, but not more than this before the exam. You can have 1 bottle of water throughout the exam. Okay, but please, guys, for those who are caffeine addict, don't drink too much coffee and tea before your exam. Whiteboard. We'll discuss about whiteboard in more details. So guys, I had 2 whiteboard when I was practicing on that. Probably some of you guys saw the whiteboard before. And when I was practicing on this, I was practicing on the red one, and red one was really small. Was like A4 size. The blue one was about A3 size or slightly smaller than A3 size, but at least it done the job for me. Okay, so the bigger the whiteboard, the better for you in the exam. Believe me, the bigger the whiteboard, the better for you in the exam. Otherwise, you will need to wipe every time. So definitely the blue one is the better one. So if you have 2 whiteboard, use a bigger one. Otherwise, you can take both together. You can take 2 small whiteboard together in the exam. They are allowed many people before to go to the exam with many whiteboard. Yes, does anyone want to ask? How you can organize your whiteboard? How can you organize your whiteboard? Very, very important, guys. And you should know that how you can organize your whiteboard and when you should start preparing your whiteboard. So for those who are going for the exam this week, you will start with ID check. After you finish the ID check, your exam starts. So after you finish the ID check, take my advice on board. It helped many people before. It did help many people. Once your ID check, your exam start. Because after the ID check, no one will ask you again, show me your whiteboard. What does that mean? Once you finish your ID check, you take your whiteboard and write your structure on the whiteboard, because that will save you time and significant amount of time throughout the exam. How you should organize your whiteboard? The best way to organize it, right? We'll come to this later. But because we started to talk about the whiteboard, here is how you can organize your whiteboard. So you need to divide it into 2 halves. Okay, this half, the written half on your left side or right side, do whatever you want, but anyway, you need to make 2 halves. 1 half is blank, as you can see. 1 half I did write. This half, you will not wipe it throughout the exam. This half you will write even before the exam. After I finished my ID check, I had 35 minutes until my exam start. I used this 35 minutes to organize my whiteboard. No one told me this advice before, but I took the risk in the exam. I said, okay, I finished my ID check. I have time. Let's do something. What I need to do, organize my whiteboard. I did it, and I thought, okay, if anyone will ask me again, show me your whiteboard, I will wipe it. If no one asked me, at least I saved some time. So I did organize my whiteboard in this half and half. You can use it upper half and lower half, or right and left. To be honest, I done it upper and lower. However, I think the best way, which I didn't do that right and left, but I think this is the best way, guys, for you. Why? Because you will write in front of this on the opposite side what you need to write. Okay. For me, I done it upper and lower. It didn't do any problem for me because this is what I used to practice. But for you guys, please use it right and left. It is much easier. And as you can see, I wrote here start with open question, history of the presenting complaint. And then when you finish history of the presenting complaint, most likely it will be your minute, 1.5 or 2 minutes when you take a detailed history of the presenting complaint. Then ask about ICE, and the first question of the ICE will be ideas or thoughts. That will be around minute 2, 1.5 minute to minute 2. Then, because we said before, better not to ask all the 3 questions of ICE together. So you try to put something in between. For example, after asking about thoughts, ask about some differentials. And then ask about worries or concern. Then again, ask about red flags, rule out some red flags. And then ask about expectations or hoping from today's consultation. Then it depends. You can ask about family history, ministerial history if it is related. For example, if it is acne case or woman health case, social history. And in the social history, you write what usually you forget. For example, I used to forget about over-the-counter medication. For example, if someone is asthmatic or having CKD, abusing non-steroidal. So you need to ask about over-the-counter medication if it is related or you think it is related. If the heart failure patient coming with worsening symptoms of heart failure, we mentioned that ibuprofen sometimes can make the heart failure worse. So you write here in the social history, what did you forget to ask while you are practicing and preparing? For example, if you were forgetting to ask about sick notes or kind of work, because that will help you in the management, you probably write here offering sick note, okay, or social prescriber, all of that. Don't forget to ask about impact, because sometimes I did forget to ask about impact. So I did highlight impact as well. Management, you go for the management and see number 1, addressing the ICE and telling him the diagnosis. You always do that. In my advice, when you start your management, guys, you will have 12 cases in the exam. From the 12 cases, you will have most of them, probably 8 cases or 9 cases, around that number, that you will be able to follow the structure. I know some cases it will be hard to follow the structure, especially if it is social gardening case or safe concern or patient coming asking for a medical form or something like that. So definitely you will not follow that approach. The case will take you wherever the patient will take you. So you will move with the patient up and down, right and left, until you will find out why he's coming today and how you can make your management plan with him. But most of the cases, if you follow this approach, believe me, it will help you quite a lot. So this is here, okay? We stopped at the management and we said ICE is the first line plus telling him the diagnosis. So you address his concern. He's coming worried about meningitis. It is not meningitis because 1 to 3. However, it looks like it is viral illness or bacterial illness or whatever. And then you can divide management into things patient can do. For example, lifestyle modifications, over-the-counter medication. If it is viral illness, give him paracetamol or ibuprofen, whatever. Safety net for the patient when he should seek urgent medical advice or come back. Okay, if, for example, having any red flag symptoms. Then what we can offer him, face-to-face, bloods or investigations, giving him medications, doing some referrals, giving him some leaflets or signposting, and follow up with the patient. You can modify the management as per what usually you forget. For example, you can write at the bottom here sick notes, for example, if you usually forget about sick note. Okay, but usually this will cover most of your consultation structure in the exam. The blank one, so this half, guys, you will never wipe. Listen to me, guys. This half, that written part, you will never wipe it throughout your exam. This half, okay, it will be from case 1 to case 12 in front of you. What you will wipe the other half. This half you will write with each case. Then once you finish the case, you will wipe it. You will wipe it. So you will not touch this one, but you will touch this one. You will wipe. You write here. For example, patient told you about any particular source. He thinking could be meningitis. So you write here meningitis. Concern, what he is concerned about. Expectation, he want antibiotic. Okay. Work or impact or anything you think it is relevant and you need to address in the management, you write in this half. And this half, you will play on this in the case. And then once you finish the case, you wipe this, and then you will use this for the common case as well. That will save you time. No one told me this advice before the exam. And I did meet many people who even done the mock with us, and they didn't know that they can start preparing the whiteboard after the ID check. So if you follow this, believe me, guys, it will save you time, it will save you effort during your exam, and it will give you some rest and peace of mind when you are going for the exam. Okay, so anyone has any question about the whiteboard? We had many questions on the even the WhatsApp account for Imtiaz Academy about whiteboard. And someone asked, where did you get the whiteboard from? Because I work in Manchester, there was a convenient.
Can I ask a question?
Yes.
Can we prepare this whiteboard before the ID check?
No, you can't. You can't.
Okay.
You will tell you, show me the whiteboard. You can't.
So they want to see the blank
Yes.
whiteboard before that. All right.
Yes.
Okay.
Once they see the whiteboard, the blank, once they finish, you do whatever you want.
All right. Okay.
That's
Thank
why your exam start after your ID check. Okay.
All right. Okay. So if after the ID check, if we prepare the whiteboard, so before the exam starts, they do not check it again or
They
anything?
don't. They don't.
Yeah.
They don't.
Okay.
Okay.
Thank you.
No worries. Guys,
Yeah.
where you can buy from online, I bought it from one of the local shops beside my practice. It costed me £1.5. Probably you can find it online, £2, £3, I don't know.
Sorry, Amr, have you told what's the size of the whiteboard?
A4, A3. Whiteboard, this one is A3 size,
A3, thank you.
guys.
Sorry, I just want to know where did you keep your whiteboard during the exam? Or do you have to be looking down the whiteboard and answering the patient? Or did you like place it where you can be having a look while
Good.
talking to the patient?
No, listen, if you prepared this before your cases, so you don't need to look into the whiteboard too much. You will only write few keywords here in the blank one. The few keywords that you need to address. You are not writing everything behind your patient. And you should, while you are practicing, you should adapt to keep the information in your mind. Most of the information, you only write down the key things in the whiteboard or in the practicing paper. Because you need to keep some eye contact. If you are really struggling, tell the patient that I will just be writing down some important information by giving you my full attention. Just in case if you find me looking down like many times, or I'm listening to you and giving you all my attention. Okay, but try not to overwrite, guys. You need also like some degree of eye contact. And if you finish this, you will just write few things in the other half, the blank half. You write only few things.
Yeah. Can I check what?
Amir, can we take 2 A4 size whiteboards?
You can take 2 or 3.
Yeah, because if on one we can write all these things.
Yeah, you can.
Yeah, because otherwise, if we wipe, then maybe by mistake we wipe the other one as well.
It is quite hard to wipe the other one. But the advantage of having one big whiteboard, because you can write beside on the opposite side the match. Yes, for example, in front of ice, other side, what is his thoughts? In front of concern, what are his concerns? In front of expectation, what are his expectations? Okay. For example, his work.
But I bought 2 A4. So nothing is for £2, Amir. Nothing you can buy for £2. It's like £6, £9, like that in Amazon.
All right.
Yeah, so
£1.5. If someone in Manchester or near Manchester, I can tell him where is the shop.
sorry, can I just ask you a quick question?
Yeah.
In that 3 minutes, when you want to kind of prepare, like for example, just an idea that what could be the case, do you write it beforehand, like a few things in that blank part before actually saying the case?
Good, yes. So while you are reading the doctor's note, many times you will find out there is some important questions you need to ask. For example, and even we mentioned that before, one of the easiest examples to apply for this, when you are doing cross and match. You are doing cross and match between the past medical history and medication. For example, your patient is taking aspirin, no any past medical history or indication for this. Your patient is taking furosemide, it doesn't have heart failure. Why? So this you need to write on that blank one, that blank half. If you think there is any other thing that you need to write as well from the doctor's note, in the 3 minutes, yes, you write here. You don't touch this one. You just write here. So you can prepare some questions in advance in the blank one, yes, because this is the case half. This is the every case half.
All right. Can I ask you a question, please?
Yeah.
Speaking of making eye contact with the role player, are you supposed to be looking at your camera or at the image you see on the screen?
Good. My camera, I put it just on top of the screen. So I was looking in the screen like this, and at the same time, I'm looking at the patient. Okay. You can use your laptop, one of the also other ideas, and my friend done his exam from his own laptop. You can use it from your own laptop. So put the cam just in front of you, okay, it's just above, or use your own laptop. For me, I put the camera just straight away above the notes.
So what if, for example, we use the practice monitor? It has an inbuilt camera. So, but there's obviously we cannot look at the camera. It's on the top, and obviously image is in the center of the screen. So probably that will be quite awkward to look at the camera and not on the image itself.
They should appreciate that. Even the most important, you're looking in the same direction, but they appreciate that because you are looking at the doctor's note in the same time you are talking to the patient. So I don't think they mark you down for this. But if you're looking at your patient at all, and you are all the time looking down, writing behind him, or you remember, guys, I told you many times, when we done the mocks, some people were doing like this in a video consultation case, or like this, okay, or like this. So this kind of body position or body language is not good. It could be misunderstood in a different way. But don't be all the time also looking down, just writing behind the patient, and you're not looking at the screen or at the camera. Even if you're not looking at screen, they should consider this as eye contact because you are looking in the same direction where your patient is. About few centimeter, okay, or like couple of centimeter away from the screen, I don't think it should be an issue between the cam and the screen itself where the doctor's note is. Any questions, guys, before we go?
Amar, can you do one favor only, please? Yeah. Can you just put the screen and show us how we should be seeing? That will make us more clear.
Yeah, guys, the same like I'm talking to you now.
That's the same. Our poster should be like this.
Yeah, I'm looking at the presentation now.
Yeah,
having the notes, and I'm looking at the camera itself at the same time.
Yeah, because camera is a little bit on the top. You will be looking like that. That will look awkward, I think so. Isn't it?
Well, my camera, because you can adjust the height as well. So I put it straight away. The same, almost the same position where the built-in camera for the laptop.
Yeah. Thank you.
So I can see clearly now the notes, and I'm looking at the camera at the same time. I can even read open question, history of presenting complaint, ideas, differentials, concerns, red flags. At the same time, I'm looking almost at the camera itself.
So I did a course with RCGP. The examiner, they told that they know about this thing and they don't mind this thing if you look a little bit this side or that side.
Exactly. They should not mark you down for this. But if you're not looking at the patient or the screen and you all the time looking down, it's not good. You should not that kind of people who struggle to remember what the patient is telling you. And this is something I was working on this during all my GP training. Even I don't write at the same time when the patient during the consultation. I finish my consultation. After the patient goes, I write down my consultation quickly.
In terms of the cases, I've gone through the walkthrough, the videos, they send the link. The cases one after another will follow and like naturally, do we have to click on anywhere, anything?
No, you don't need to click anything. Everything comes by itself. You don't click anything. You only click when there is a technical issue you don't hear good. For example, the doctor's note came late or appeared late. The patient came to you like 15-20 seconds late or something like that. Yes, you raise your concern, tell them there is technical issues, patient came late or appeared late, all of that. If any issues, guys, in the exam, please flag it because you can repeat the case at the end. You can repeat the case at the end.
Sorry, Amra. So how can I flag it in the middle of the consultation? What if they didn't consider it as a big issue? I will lose a case.
You should tell them. You should tell them, and they should understand. I know many people who repeated twice or 2 cases at the end. Raise your hand, and they will come to you, and then you just write to them.
While I'm doing the consultation.
Yeah, while you are doing the consultation, raise your hand. That's why they put this, and they will tell you the instruction. If there is any technical issue, raise your hand. They will come to you.
You
can
I
write
press the button of raising the hand.
Yeah, you can, or you can write to them quickly while you are talking to the patient. Tell the patient, can you please just wait a second because I'm having a technical issue now. And you should verbalize this, because the examiner will hear it as well. If they will not allow you to repeat it, just write, I'm having technical issues, the voice is not clear, I can't hear you clearly, and you just write it on the chat for them. Or raise your hands, they will come to you. The best thing, you raise your hands, they will come to you.
So they speak to me during the consultation?
Yeah, they can come to you, and or text you, or they will speak to you.
So you mean we'll continue their consultation as normal?
You will continue, and then at the end they can repeat it for you. But you continue, because this is anyway your 12 minutes.
All right.
Because even if they will repeat it for you at the end, but please don't assume they will repeat. Work on the worst case scenario. That's why you need to continue. Because at the end, if on the worst case scenario they will tell you no, we will not repeat it, at least you've done the case and you flagged it for them, and the recording will go to the examiner and they will know that you flagged it for them and you mentioned that there's a technical issue but you haven't repeated. So work on the worst case scenario, but most likely they will allow you to repeat. I know many people who repeated 2 cases at the end. And that's why after you finish, guys, some of you will wait for a long time because others are repeating the cases. I waited 45 minutes, and I assume I waited for 40 or 45 minutes because other people were repeating some cases as well.
So how we will flag up? You mean that just talking to them and raising hand?
Yes. See, there is a raising hand button down. Once
once
you click on this, yes, it will appear to them.
Sorry, Andrew, may I talk? Just to clear the things to everybody. As previous colleague mentioned, during the exam, any case, you can hear, well, any issue happen, just immediately verbalize. Don't write or raise hand or whatever, because sometimes the invigilator will not looking at you and see what's going on. Immediately verbalize. Sorry, I have to interrupt this. I can't hear or I can't read, whatever the issue was. That's it. Very simply. Okay.
I will do both. Guys, I will do both. I will raise my hand and I will comment. Can you just give me a second because I can't hear you clearly? I think there's a technical issue here. Okay, so flag this verbally and also raise your hand.
And unlike on reality, how like every single glitch I should just comment on.
It's up to you, but definitely in the exam there will be technical issues. Mine, I remember for 2 cases there was a delay in the patient start, probably a few seconds, 10 seconds or 15 seconds. I didn't flag it, to be honest. I just let it go and I passed both stations. But I know many people who know they flagged it and they repeated the case. It depends on your personal view. If something is really miserable, voice is interrupted, internet connection is not good, something really happened, you can't continue like this, you need to flag this straight away.
But 10, 15 seconds is quite a lot. You can do like a safety net or follow up.
Yeah, I left it, okay? It didn't affect me, I left it, but for people, I told you, for other people, no, they flagged this and they repeated the case.
That's a quick question. According to this whiteboard, do you follow it strictly? So you start with the medical side before the psychosocial side, is it right?
I was trying to follow this in most of my cases. Unless, I told you, unless the case from beginning is purely social, or for example, patient coming asking for a medical form, coming asking for respective form, DNA CPR form, or any other medical form, or fit note, or all of that. Someone coming to discuss with fit note. So you probably will not follow this structure. But most of the cases, you will be able to follow the structure, the medical structure or medical consultation structure. But some of the cases, probably I would say 1/4 of them, okay, no, you will do some twist. You will start sometimes with the social history, all of that. Check their understanding, what kind of medical form you would like, why you need this medical form, all of that. And when you are practicing, you will find this structure will follow with you most of the cases. So that flow of consultation, you can apply it for most of the cases. At least I would say 2/3 of the cases.
Sorry, Omar, I log in late. What is I couldn't read the one that says in between family history and social history. It says plus, minus.
Menstrual history, sorry. Menstrual history.
Menstrual history. Thank you.
No problem. Okay. Guys, I can send this on the WhatsApp group. I can send you the picture on WhatsApp group. That's fine. Let's move. Here's the exam day, guys. Okay. So the exam day, as I said to you guys, you need to arrive at least 1 hour earlier. You need to double check your IT system, computer. No one removed the cover or the poster cover from the wall, all of that. Again, computer, make sure only one screen. And please take laptop with you guys just in case. So I took my personal laptop just in case if something happened in the computer. Take light breakfast, and as we said, guys, don't drink too much coffee. ID check, that will happen first after your exam will start.
Can we take the bar of chocolate or something like that?
You can, yeah. I took with me one chocolate. I took it in the break, 10 minutes break. I ate it in the 10 minutes break. ID check, whiteboard after your ID check. So once you finish your ID check, please, guys, and please, okay, whiteboard. Finish your whiteboard after straight away your ID check. And then flow of the cases and the IT issues. If there is any IT issues, please flag it straight away. Don't wait, flag it straight away. If you would like to go for toilet, you need to, again, raise your hand. And unfortunately, if you need to go to the toilet, that time is counted from you. They will not stop the exam because you are going to the toilet. No. It's okay if you want to go to the toilet, you need to let them know, raise your hand. That's why light breakfast, little caffeine in the morning to make you going to the exam. If you eat heavy breakfast, you drink quite a lot of tea or coffee, you will need to go to the toilet many times. Foods, no food allowed during the exam, but drinks, you are allowed 1 bottle of water. But in the middle of the exam, in the 10 minutes break, you can have a piece of chocolate or something like that for your sugar. After the exam, you need to stay in your place. I stayed about 45 minutes. Some other people stayed about 15, 20 minutes, 30 minutes. And I assume because if others are repeating the cases, that's why. Because all of us should finish at the same time. And you never log out. Never, ever press log out until they will tell you, yes, now you can log out. Never, ever assume your exam finished, you press log out. They should tell you it is safe for you now to log out. Don't log out by yourself. Never, ever log out by yourself. Then they will ask you to wipe the whiteboard, and then you finish. If you want to revise, you can revise. If you don't, just relax, because nothing will happen. Even if you revise everything, you will wait for the result. Don't think too much. That is what you need to do in the exam day. Whiteboard we talk about, and this is just some tips. You guys, you need to be very smiley in the exam. Okay, very smiley in the exam. You need to be very calm and cool. My advice, don't jump into ice in the first 1 or 2 minutes. Let the patient talk in the first golden minute. Collect more history and ask ice between minute 2 and 3. Don't interrupt the patient in most of the cases. Don't interrupt the patient. If the patient is over talking, let him talk. Give him his time. Let him speak. I know some of my friends, they let the patient talk as much as they can. They pass to the station. Follow the cues as much as you can. Be empathetic. Be empathetic, reflect on what the patient is telling you. It must be difficult. I can imagine how hard is it. I can imagine now where are your thoughts or where are your words coming from, all of that. Simplify, think to your patient. You can use body language, and you can even write or draw. If you have extra piece of paper or extra whiteboard, you can even draw simple things and show it to them. Or you can explain by using hand. I used to explain by using my both hands. Double check if the patient is understanding. Does that make sense? Do you have any questions? All of that. Don't blame the patient if the patient didn't understand. If you think patient didn't understand, don't tell him, I can see you don't understand. No. Tell him, I'm sorry if I made you confused. Let me simplify it in another way, or let me explain it in another way. So I'm really sorry if I made you confused. Please be very sensitive. If you are telling him long-term conditions, and we said diabetes, hypertension, atrial fibrillation, all of this is breaking bad news. Not like cancer, but still breaking bad news. And jump to the management by 5.5 minutes, 6 minutes. Some people did manage and get past in many stations before, but they started management by 7 minutes or 7.5. You can do that if you are quite fast to tell the management, but most of the cases you should finish your data gathering, all of that by 6 minutes, and start your management by 6 minutes. Don't forget safety net, follow-up, face-to-face examination, health promotion, allergies, and side effect. If you are prescribing any medication, don't forget to ask about allergy and side effect. Okay? All right. I think we're done, guys. Anyone has any questions? Before I will just have 2 comments on probably 2 things.
Yeah, I have a question. If, for example, if you some of maybe station, maybe if you have finished it earlier, can you go to toilet on that time? Probably maybe you still have 2 minutes left in that station.
You should tell them. Yeah, but you can't go by yourself. You should tell them.
Okay, thank you.
You should tell them that you are going. Okay.
And
So
were you following the structure to use the medical notes in front of you to just to buy time? So if the patient told you that I have come here, he has been seen 1 week ago, and he has come because he still have tiredness all the time. Can you tell him, he will tell you that I'm tired, or telling you for a few seconds? Can you use the notes? I can see from the notes that you were complaining of 1, 2, 3, 4, just to buy time to jump to management by 6 minutes, or they will consider that you didn't give the patient the golden minute?
No, you can reflect on the notes. I can see you are coming today to discuss your blood test results. Is that correct? And then you ask him, why did you have the blood test results done in the first place? Okay, the best thing in that case to follow the structure. Don't give him, in my opinion, which I did follow in my exam and in my practice. Don't jump to give him the blood test results in the beginning. Tell him, would be okay with you if I can just ask you a few questions to understand or to be in a better position to explain your blood test results. And then you tell him, why did you have the blood test done? You collect history and you follow the structure. If you tell him the investigation results from beginning, you probably will not be able to follow the structure, especially if it is something quite serious or diabetes, for example, or all of that. So I used to not tell the investigation in the beginning unless the patient is really pushing you towards to give him the investigation results. If he's not pushing you, tell him, would be okay with you if I can ask you some questions so I can be in a better position to explain to you the blood test results. This is the first time I'm meeting you today. Is that okay to ask you a few questions first? Then I can explain the blood test results. Because definitely it's the first time you are seeing the patient today. But in most of the cases, again, you are able to follow the structure. You will be able to follow the structure.
Yes.
Sorry to interrupt, Amar. I mean, how many times do we have to wait before we give the results? Provided how many times does the patient insist before we give the results and then take it from there? Is it once, twice?
I would just ask him 1 time only.
1 time, okay.
Yeah, because if he's still wanting this, that's fine. Okay. Yeah, that's fine. I can see you are very keen to know the results. I'm happy to give you the results first, and then I will ask you some questions so we can make sure there is, we are both on the same page.
Okay, thank you.
Most if you just ask the permission, would be okay just to ask you some questions first, they will agree. If you are asking nicely, yes, smiling, yeah.
Okay, and you mean by jumping to management by 6 minutes, does it mean that starting telling about the diagnosis by 6 minutes, or I should tell the diagnosis before that?
Well, your management starts once you address his concern and telling him the diagnosis. So you address his concern and telling the diagnosis. This is the first line of the management, because all the management plans that you will be making now, it will depend on what is the diagnosis and why it is not his condition. For example, we mentioned before, if someone is coming, for example, someone is coming asking for sleeping tablet, and he is having obstructive sleep apnea. We mentioned that last time. So in the management, you will tell him, Mr. William, I can see, or I understand you came today asking for Zobiclone. However, Zobiclone won't be the best option for you because it can make your throat muscles relax more, make you more snory at night and more tired in the daytime. From what you have told me, you don't have a problem to fall asleep. However, you have a condition called obstructive sleep apnea. And then so you addressed his expectation. He wanted Zobiclone. No, it is not good option because it will make you more snoring at night, more tired in the daytime. And then you told him the diagnosis, and then you gave him gap for a few seconds. Have you heard about this before or no? And then you start explaining the condition, and then you start listing the management option for the patient.
Sorry,
New things that you can offer him.
Amar, on that note, like you've mentioned that, for instance, if it's a case with sleep apnea, just out of curiosity, I mean, would we have the Epworth score, or I mean,
I advise no. You will not have time.
yeah, and it's difficult to remember all the points as well, isn't it? So, I mean, how do we maneuver it safely enough to sort of conclude that, oh, this could be sleep apnea, even if
You
we
will tell
don't.
him, I'm suspecting it is likely to be obstructive sleep apnea. You explain it to him. Tell him there are many things that we can offer you and help you with. There are things that you can do, things that we can offer you. Then you ask him which one he wants to speak about first. And then for regarding things that we can do, we can bring him for face-to-face examination. And before that, I will send you a link for a questionnaire called Epworth Sleepiness Score or questionnaire. It is just few questions to assess how likely you will fall asleep in different situations. Because after my examination and after your questionnaire, I will refer you to sleep clinic.
Okay, thank you. And I assume it's the same for the IPSS scoring for the Lux station as well. We cannot do the IPSS score, isn't it? In the exam, it's just not possible. So can we say we can send you a leaflet to do like a questionnaire, and then we'll see you face to face?
My advice. You know the 6-item cognitive impairment test, six
Yeah.
test. Guys, the 6 questions, you need to know them. Sometimes, okay, even in the reality, sometimes the patient will insist, what are the questions? Especially for 6-item. So please, guys, try to read this. And also for Epworth sleepiness scale, there are few questions. Just read it before the exam. Whenever you remember for them, just tell him or ask him. And for 6-item, please, guys, remember this. Please, guys, for 6-item questionnaire, 6-item cognitive impairment test for Alzheimer dementia or dementia, suspected dementia. Please, guys, do remember the questions because you might need them in the exam. Anjum? All right.
Sorry,
Yeah.
I have a question. Though it's very unlikely, but in case we finish the management early, like we discuss everything and we finish by 11th minute. So is that okay then? Just keeps.
Yeah, that's fine. I done it in one case and I got clear pass. I finished 1 minute early or 1.5 minutes early. I asked him, do you have any questions? Anything you would like me to repeat? Anything that you think it doesn't make any sense for you? I asked him 3 questions to tell him if anything else you would like to discuss today. No? Okay. Safety netted and yes, and that's it.
In terms of the 6 memory tests you're talking about, when we say them, then obviously we will make them an appointment and to fully evaluate their memory, and we'll do this memory test as well at the same time.
Yes.
So still we need to do that. Probably, do you think that we will decide there and then on while we are taking consultation that you're having memory issues or not, or probably we will call them face to face and
most likely you will not do any questionnaire in the exam, and this is a general rule because this takes time. Even the 6-item, it will take from you like 1.5 minutes, probably to 2 minutes, and definitely you will not be able to finish all the management plan. However, if the patient will ask you what are the questions, which could happen in the exam, or maybe the patient, some of his family members told him there are some questions your doctor will ask you about. What are these questions? So he came to ask you, yeah, some of my family member, my wife, my son, my daughter, my friend told me, yeah, there is some questionnaire or few questions they told me that your doctors will ask you. What are those questions, doctor? If this happen, you need to know the questions. That's why. This is just in case if they will ask you. This is just in case if they will ask you what are those questions. But in general, just tell them that when you come back, or I will ask you some questions to assess your memory. I will ask you some few questions, about 60 questions to assess your memory when you come back for face-to-face. Unless he asks you what are the questions, you don't need to tell.
I've just got a quick question, Amar. You know, with genetics cases, would you recommend drawing on the whiteboard, or would you recommend sort of trying to explain without any diagrams?
Most of the genetic cases will be straightforward. You don't need to draw. Either autosomal dominant, so 1 in 2 chance, or 50% the chance. If it is autosomal recessive, so it is 1 in 4 chance, or 25% the chance that one of your son will have it. So you don't need to explain this. I mean, like, you don't need to draw this. It is not easy. So it most likely will be straightforward.
Okay, thank you.
Either autosomal dominant or autosomal recessive. But drawing the, the inheritance tree, that will take time for you. They don't need to do that.
Okay, thanks.
Okay. If you don't have any questions, guys, I will just comment on probably, yes, 2 things. You remember, guys, case for TB, because I discussed this with one of the doctors, and they also had different opinion, which could be also respectable. I told you the best option you discuss straight away with infection control team, because that makes sense. This patient, if he's going for chest X-ray or coming for face-to-face or all of that, there is some risk that he can transmit the infection. However, if you explain this to him, you tell him, or you can come to the practice for face-to-face urgent today, and we'll do the blood urgent for you today, and also sputum sample today, and also chest X-ray. I will send you for chest X-ray, or I will write on the system in the request that we are suspecting a TB. So the team in the X-ray will be aware. When you go there, they will take the precautions. On your way there, please wear a face mask. And if you come here today as well, I might give you another face mask, not only the surgical mask, but a more tight face mask to put on your face. So you have 2 options here for TB case. Either you tell the patient, okay, because this is, you might, there is a potential, if it is a TB case, you can transmit the infection to other. I will speak to the infection control team or TB team, okay, on how can we get you seen today by the TB team, having all the investigations done in one place to minimize the risk of transmission. Or you can come today, but we need to take very extra precautions. You need to wear a face mask until you come here, okay? And you come straight away up, okay? I will let the staff team know that once you come here, you go straight away up. Don't wait in the waiting room, and don't be in close contact or very close to anyone. And you explain to him, I will take blood from you, I will collect a sputum sample today, we'll send it straight away to the lab, and I will send you an urgent X-ray today, and I will write on the report what is we are suspecting TB. So they will be taking extra precautions. Tell him either this or either this. Which one you think we can do? Do you want me to wait
Name it.
Okay. Do you want me to call to wait until I call?
Who are you calling?
Sorry, guys. Can you mute
Who
your?
are you calling?
Okay, guys. So tell them, or tell the patient 2 options. Either you call the infection control, you will come back to them today with a plan, or if you want, you can come today. We'll start the investigations, but we need to take extra precautions. Don't forget, you need to reflect if the patient is living with his friends, living with his wife, with kids, with sister, with son, with anyone. Household contact, they will need also investigations. They will need also testing. And as you remember the flashcard for TB, don't forget to ask about definitely anyone with weight loss, coughing of blood, night sweating. You need to ask about recent travel, and don't forget to ask about if he got the vaccine or no. Does he have the scar on his arm or no? Did he have any TB before or no? Okay. So because I told you earlier, he can't come for investigations. However, if he can take extra precautions and very caution, he will be very caution to come. Okay. Yes, he can come for face-to-face same day. Don't forget, this patient can't go to work. Don't forget, we mentioned that this patient can't go to work. This patient will need sick note because he's at risk again to infect others. And if you remember from CKS guidelines, I even showed you the table. This patient will need isolation in the first 2 weeks of treatment. In the first 2 weeks of starting the treatment, he will need to self-isolate himself. This is for TB.
Just one question.
Yeah.
You know, when you request investigation on the same day, do you wait for the result and after that you refer to like TB team, or you refer straight away?
You tell him you will start his investigation, and I will speak to infection control team as well, because I'm suspecting, and as per the guidelines, when we suspect TB, we should refer you urgent or discuss with the infection control team or TB team urgent. Tell him, because TB is a notifiable disease, and once we suspect, we should act straight away, because we need to minimize the risk of others to get the infection as well. And as long as you think loudly, guys, your key in this exam, please, guys, your key in this exam, you are thinking loudly. Whatever you are doing, whatever management plan you are offering, you need to think loudly. Why you are offering this management plan? Why you are doing this? Why you are doing this way? Okay, very important.
Sorry, public health, who is going to inform? Is it the TB team will inform, or we need to inform?
Well, I will not inform public health. I will just tell them, I will discuss straight away today with the infection control team. But tell him that it is one of the notifiable disease, because if you are having a TB confirmed, they need to notify the public health. Okay. That's for TB. Another thing, just advice as well. If you are having a friend, for example, a friend calling you on behalf of the patient, or neighbor calling you on behalf of the patient, because they are if you want to raise any concern or raise any flag, you need to ask, is the patient is aware or no? Because if the patient is not aware, they don't get any consent. What you need to do, guys? Will you continue consultation or no? If a friend or neighbor calling to discuss or raise any concern, raise a concern about a patient, he doesn't have consent.
Yeah, I will gonna.
Will you
No.
continue the consultation or no?
No. What I would do, I would gonna ask about the name of the patient, the full name of the patient, and the age of the patient, and I will gonna listen to the concern, but I will not gonna tell her anything about the record, the medical record of the patient.
Correct.
Yeah, because it's our responsibility if there is immediate concern, or if this patient was killed the next day or the next hour, then
Yes.
yeah.
That's very correct.
Yeah.
You listen, you tell them, okay, because the patient didn't give you any consent, and the patient is not aware, I'm not allowed to release any information about the patient notes or past medical history. However, I'm happy here to listen to your concern and will act accordingly. Okay, will act accordingly. Because if there is any suspicious of, for example, patient is at risk of something, for example, self-neglect, abuse, anything of serious harm to the patient, you need to be aware of that. And then you need to act accordingly. For example, arranging same-day home visit. Okay, same-day home visit to see the patient, to speak to the patient. Before going for a home visit, you probably can call the patient to make sure they are at home. And sometimes a friend will tell you, please don't tell the patient I called you. So you reassure him, that's fine. I will just give them a call that, yes, we'll just come today, but I will not mention you. Thank you for raising all of that. We'll take it seriously. We'll make sure that he is safe and patient is safe.
But if the patient says that, while you're coming down, I have no problem, there are no issues. So how would you tackle that then?
Well, you can tell them that, well, it is just a routine. It is just a routine, just to make sure everything is okay.
And one more thing, that if we are not allowed to disclose any information,
Just let me just reply to him. And in this case, you will not speaking to the patient himself at the same time. So they will not go in more details. For example, if the friend is coming to raising the consent, tell him that's fine. I will just arrange a home visit. We'll give the patient a call today to make sure he is at home. Okay, in the time that I will see.
Yeah, you're right. But I for a moment I just forgot that I'm in the SCA exam. I was thinking it was the realist in the real scenario. Yeah, that's fine.
Yeah.
Yeah.
So if you have something like that or scenario like that, you are not discussing with the patient now. You are discussing who is coming to discuss with you. So my comment here, no, you continue your consultation. You listen to them very carefully, and you thank them very too much Thank you for coming today. Raising all of that, we'll take it very serious. We need to make sure they are okay. If they are asking you about what you will do, how you will manage it, okay, don't give too much information. Tell, well, it depends on my home visit, my examination, and then I will see. I will see what is the next step. I'm afraid I can't give you too much details about what is the next step, but will be in the patient best interest to make sure he is safe or she
So
is safe.
if I'm sorry, yeah, if this neighbor lady said that, I'm concerned that maybe her son is abusing her. I saw some bruise. Will you mention safeguarding to her?
Well, it happened. It happened, by the way, to me before with someone who was in a similar situation. But it was like the niece. There was very concerned. Even I arranged the urgent home visit. I remember this patient, and it was a miserable situation because patient had a cancer on his face. Cancer on his face, and it was squamous cell carcinoma. It took half of his face. Unilateral cancer getting worse. Patient was missing all the appointment. Over the last 1.5 years, he was missing all the appointment. He was living with his niece. It was very similar to what you are telling me now. Okay, so you arrange home visit. For example, if patient is having, for example, multiple bruises or all of that, could be a medical issue. So you need to arrange some blood test. You need to see, is it like, you need to take history from here as well. You need to speak to the patient privately, and probably you will make sure during the time of the home visit, she is alone at home, no one else at home, so you can speak with her without any restrictions. Bruises can be medical, can be accidental, can be abuse, right? Can be any bleeding disorder, anything else. You don't know. If someone is coming and raising this concern, yeah, you will take it seriously by arranging home visit, arranging some investigations, examination. But what is the next step? It depends on the investigation. If there is any safeguarding concern, yeah, we'll raise it with a specialist team to make sure your patient is okay.
So in terms of documenting, where do you document in the case notes? You know, patient can read their notes now. So how do you document it?
In the patient note, yeah, you can hide the visibility.
Okay.
Hide the visibility, and not only this, you can also tell that friend or neighbor or whoever, thank you for coming, and when I will document all of that, I will make the note invisible so no one will have access to it. Okay. Okay, guys, this is just yes. Don't forget about this. Patient confidentiality is very important. Also, you need to make sure the patient is safe. So if someone coming without the patient consent, yes, we listen, but we don't release any information. We listen, we don't release any information, and we act according to what we listen to.
So sorry, you can still tell them that there is a possibility that we will raise the safeguarding.
You can tell, yeah, you can tell him there is a possibility that if after examination home visit there is a safeguarding consent, we'll raise a safeguarding concern with the social service team.
So it's not breaking the confidentiality in this way.
Not really, because they know definitely. They know definitely if there is any safeguard, we'll refer to the safeguard team. If they are suspecting that. Now I'm not explaining to her in details what kind of blood test, what investigations, what all of that. No, we just do some investigations, examination, and that's it. Don't forget, never ever release any past medical history about her, any medication, anything at all. If she's telling you what will happen next in details, one nice way to escape this, well, I can't release anything. However, after I visit the patient, you can ask her, you can ask your friend, or you can ask her, yeah, you can ask your friend what the doctor told you today, what happened, what have been, yeah, or what has been done with the doctor. So she can know the next step from the patient herself or himself. You need to get involved into that level of discussing the management plan. Yes, if there is any concern, we'll act accordingly. If you need any more details, I'm afraid I don't want to break the patient confidentiality, but you can always speak to the patient, given he is your friend, you're meeting them quite regular, your neighbors, one of the family members, so you can speak to your neighbor or friend, so you can speak to the patient. And this is very nice. You are telling them, okay, we'll act, and you can speak to the patient so they can tell you everything you want to know. Okay. Any questions, guys? I uploaded a flashcard today on the Telegram about UTI after sexual intercourse, and I wrote many options. So please don't forget in the sexual intercourse, in UTI after sex. Okay, you can tell the patient many options, things that the patient can do, things that we can offer here. Okay, so don't forget about this, and could be simple things. Hygiene, definitely. You need to mention about hygiene. If the patient is doing the hygiene, appreciate that. I appreciate you are drinking plenty of water, wiping from front to back. I really appreciate that. Keep it up. You can also add extra few tips. For example, some women use condoms. Some people find it effective in terms of reducing the frequency of having urine infection. What do you think about this? Lubricant as well, especially if there's any dryness down below. Cranberry juice, one of the options. This is the things that she can do. Things that we can offer here. We can offer here examination, urine dip to make sure there is no any new urine infection, antibiotic for acute urine infection. Don't forget, you can offer prophylactic antibiotic either after sexual intercourse or every day for a few months. Don't forget to safety net about side effect of nitrofurantoin, any shortness of breath, any chronic cough. She needs to let us know because sometimes nitrofurantoin can affect the lung. Also, one of the management options, estrogen, topical estrogen gel. Don't forget, especially if your patient is postmenopausal, and you can sell your management plan well. Many women in your age, many women after menopause, they have frequent urine infection because of the vagina is quite dry and some irritation and soreness down below. And luckily, many of them, once they use topical estrogen gel, their symptoms get much better. Have you ever thought about trying topical estrogen before or no? What do you think about this? If she's having background of breast cancer, don't start topical estrogen. You tell her it is one of the options, but you will send advice and guidance to specialist. And if the specialist is happy and she is happy, you are happy to prescribe for her topical estrogen for 2-3 months, and then you follow up with her. Okay, this is the flashcard about. Don't forget to ask the questions I wrote in the flashcard, but don't forget to ask about the questions of STI symptoms and the question of STI symptoms in her partner as well. Okay, any other question, guys?
Amar, can I ask a question which is not related to anything you have said? It's just one case, and I just wonder like what your approach would be.
Okay.
Is that okay?
Yeah.
So if there is a patient who basically has prostate cancer, who's palliated now and he's staying at home now, he hasn't got any care home or any plan like care home plan, a care plan in place. And if family calls us like they're worried because he's confused and symptoms of hypercalcemia like confused and all those bones groans kind of like symptoms, and they're worried like what to do in this case. He's palliative already. And what my understanding is that I think in this case is like you have to find out who I mean you do have to go and visit the patient, or you can arrange for home visit. He doesn't, I'm not sure whether he wants to be admitted, but you need to find out from the patient. But he's confused now, so I'm not really sure his mental capacity as well. Just wonder what your take would be on this such a case.
Confusion could be from many things. Thank you for sharing all of that. Again, if you're speaking to someone, and confusion could be from many things. Could be because of his calcium level is quite high, which is expected in people with cancer, that cancer cells went to the bone. Could be they are in pain or they are having any infection. A common case scenario in old people, if they are having urine infection, they will come with stomach aches, they will come with confusion as well, or we call it delirium, which means short-term confusion due to things that we know. I agree with you. She needs a home visit, and I need to speak to the patient. Probably I also need to involve the palliative team and Macmillan team, because one of the options, or if the calcium level, we suspect that calcium level is quite high, we usually send people to the hospital. But I appreciate he's again on palliative care, and it's a tricky situation. So it depends. Did he have any advanced care plan in place?
No.
For him in place or no? And what do you think? What is his baseline function? Because if we're thinking he's really deteriorating and his baseline function is really poor, and we are anyway expecting that he's approaching end of life, I don't think it makes sense that to send him to the hospital, because if we send him and we treat him for the high calcium in this point, after 2 days he will have again high calcium, because we are not treating the cancer itself. Everything would be by negotiation, and you explain to them, well,
Okay,
he's
sorry,
or high calcium high. If we send him now, next week he might have the same. Are we sending him back to the hospital, prolonging his suffering, or should we now focus on keeping him comfortable at home?
Okay,
Right.
so
One thing, we can also give him some good hydration can help, even if it is high calcium. Good hydration could be help. Probably you need to revisit his medication. If he's, for example, on any diuretics or any calcium tablet, vitamin D tablet, you stop all of that.
Okay, so adding more information to this case.
Yeah.
He's actually talking to paramedics who did everything. It's not UTI. He's 65. His baseline is brilliant.
Mm.
How would that change anything in our management?
If his baseline is brilliant, as you mentioned, we are not expecting he's approaching end of life. Palliative doesn't mean end of life. Palliative doesn't mean end of life. Okay, so palliative, we are not treating the cancer. We are just treating the symptoms. One of the treatment of the symptoms, you send him to the hospital for IV hydration, and just in case of severe hypercalcemia. But if we are approaching end of life with poor life function, poor baseline function, yes, there is no meaning to send him to the hospital. But if, as you said, good baseline function, fit and well, he is independent, washing himself, feeding himself, and now he's having sepsis, or he's having, for example, acute hypercalcemia or severe hypercalcemia, yeah, we can treat him. We can send him to the hospital. How many times in the hospital you find people with advanced cancer and they're coming for IV antibiotic, or they are coming for whatever they're coming with?
Okay, shall we inform or speak to the oncology team on call
One of
before
the
making this decision?
or palliative team. Sorry, Macmillan team. Macmillan team as well, one of the options, because usually they know the patient and they are aware of him. I will speak to Macmillan team as well, or oncology team on call, whatever. Yeah.
Okay. Thank you.
Again, guys, try to make it sensible management plan. Try to think loudly and try to give the options. Yeah, hospital admission is one of the options. What about his wishes? What do you think? Is hospital? And always ask them, what do you think? Do you think hospital admission for him is a good option, or you think it just will prolong his suffering and it will make it hard for him? Do you think he's fit enough to go to the hospital every time he is feeling unwell, or should we focus more on his like keeping him comfortable, dignity at home, all of that?
So it will all depend upon his wishes, advanced care plan.
His wishes, advanced care plan, or if he's approaching end of life, what is the meaning? If palliative team, they are thinking that he's approaching end of life, and for example, they prescribe for him the palliative medication or end of life medication or anticipatory meds, so that means they are expecting this patient will die very soon.
But obviously, if you have prescribed the anticipatory medications, and you already would have advanced care plan or ESCP, so
yes,
probably that would be easier for to follow.
Yes, so I will tell them, usually in such situations, if we suspect high calcium level, we send to the hospital. I'm very mindful of his background, and I'm very mindful of his stage of cancer now, and that's why we don't have too much options. That's why I would like to hear your thoughts. What do you think? What should we do next? You always be very sensitive, very kind. Yeah, we have a few options now, and with a very low tone. Okay, you can shout all the station. I mean, like not shout, but with a very, very loud tone. But when it comes to discussing with a patient about end of life, we are not sure what to do, few options, always try to speak in a very low voice, very low tone.
What if like the patient is confused, it doesn't have the advanced care plan? Can you go with what the next of kin wants?
Could be, or a best interest meeting as well, or best interest meeting, so you can discuss in the best interest meeting with a family member, with one of the palliative team or palliative nurse, probably also Macmillan team, and one of the community nurse or district nurse, just to do a best interest meeting to find out which one is in the best interest of the patient. We can do it as urgent today. We can discuss with them, and we can involve you as his next of kin or his daughter. What is the best option that it will be in the best interest of his dad or the patient himself.
Can the palliative team start the IV fluids and IV bisphosphonates at home?
They can start sometimes fluids at home, even subcutaneous fluids they can start, or some fluid at home they can start. So you can discuss with them. Well, we can also have the option that palliative team and district nurse can give him some fluid at home.
That is worth talking to them, at least if he doesn't want to go to the hospital. Yeah.
Yes, we have options. We can manage him in the community instead of sending him to the hospital. Hospital, usually, they will give him some fluids in the drip. Sometimes they can give some medications as well. And sometimes they do heart tracing to make sure it is not affecting the heart. You explain the risk of hypercalcemia. Can affect the heart, can cause heart arrest or cardiac arrest. We call it the heart stop pumping, all of that. But
Palliative team also has the rapid medical team. Can they also help in between?
could be. You can tell them, we can try to manage in the community. I can discuss with the palliative team. I can have a chat with them to see if we can provide him, for example, some IV fluids at home or no, just for dehydration if he's not drinking enough.
Yeah. Okay.
Okay. Don't forget to ask about what the other side, the daughter or next of kin or lasting power of attorney think. What should we do? Any advanced decision in
You have to
advance?
bring them on board, isn't it?
Are we suspecting or expecting that unfortunately he's about to pass away very soon because of the advanced cancer or no? Because if it is the case, we don't have too much options, I'm afraid.
Sure.
Okay. I had this kind of consultation many times in the hospital and even in the GP. I remember one of my patients passed away. She was absolutely fine until I have met her, and she came with advanced cancer. And after few months, we started palliating her because cancer was already in advanced stage, and we already focused on her palliating her. And I had this chat with her next of kin, with her son and daughter, done many home visits with her, and we agreed at the end we're not doing any more investigations, no any scans, because her liver function every week when you do it, it is going skyway high because the liver metastasis. So we agreed to stop everything, just palliating her. Palliative nurse was visiting her, district nurse were giving some medications, all of that. So a very common case scenario, and you probably will find something like that in the exam, because you will find definitely as a GP.
Sorry, Emma. So I guess you're quite right. So you're saying that if someone is approaching end of life and who's having hypercalcemia, even if you treat it, it's going to be hypercalcemia because of cancer. Do we tell them like hypercalcemia, like what you said, like, it can affect your heart and stuff like that? Do you think that would be insensitive, or that's fine to go on and tell them?
No, you tell them that usually, if someone is having high calcium, we send them to the hospital to have more investigations, check the heart, check some blood tests to check how high the calcium is, because sometimes can affect the heart, can affect the brain, can affect many things in our body. However, because I'm mindful that he's approaching end of life, probably we're looking into the last few days or few weeks of his life. Do you think that something that he would like to do?
Right.
If you put yourself in his place, what do you think?
Right. Yeah. And then probably come to the decision of not doing so many blood tests, because that's won't be good for.
Yeah, let's focus on keeping him comfortable, giving him the best dignity that he wish at the end of his days. And I agree with you. Anyway, I will come today to see him again, to see if there is anything that I can do for him. For example, if there is any infection, any medications that we need to stop. Don't forget, guys, in palliative cases, you probably will find some medications that you will stop. Don't forget, deep prescribe also very important in the exam.
Right. Thank you.
No problem.
Another case with another confidentiality scenario. It's like you're speaking to like a social carer, sorry, a social social worker, because you're having concern regarding somebody who's the symptoms that he's telling us is about he's actually withdrawing, alcohol withdrawing, and he doesn't want to go to the hospital. And also in the news, there was like a 2-week referral from the consultant for suspected cancer that the patient didn't attend because he's neglecting himself. Okay, so you speak to the social worker, and we both agree that we need to send this patient to the hospital. My point of view, shall we discuss the fact that there is two actually the consultant, the GIT consultant wrote back to us to tell us the patient didn't attend 2 week his appointment. Would that be professional to disclose something like that with a social worker, or do you think that because that is a very tricky situation with confidentiality?
Usually, the social worker for the patient, they should be aware of a part of his medical background. Especially, this is a part of self-neglect as well, and this is a self-neglect safeguarding case. He doesn't have capacity, and yes, he needs. It sounds like from what you have told me, he's under the influence of alcohol, and I don't think he's having capacity. So we need to act in the best interest of the patient. If he's having withdrawal seizures or withdrawal symptoms, or we're thinking something serious for him, I would agree with you. He needs to be seen by the hospital, and we need to send him. Even I'm afraid to say, but against his wish, because he doesn't have capacity now. Again, we can do a best interest meeting quickly, and we'll act on his best interest. Regarding like releasing some of the informations, I would say yes and no. It depends. I don't think if you release this, like I can see even he did attend some of his urgent appointment before, without going into much details. Yeah, he did attend some of the urgent appointment before. So you didn't disclose that much, but you told him that yes, I can see he even doesn't attend some of the urgent appointment before.
Okay, but without mentioning that it was 2 week referral or anything like that.
It doesn't make any difference here, but you reflect on that. Yeah, I can see from the notes even he missed some appointment which are very urgent. He didn't attend before.
Okay, thank you.
Okay. Okay, guys. I will upload this session because some of the people won't be able to attend today. Some of them asked it to upload, so I will upload it on the website. And best of luck for who are sitting in January this week. And good luck as well, guys, for all of you. And hopefully you prepare well for February and March exam. If you have any questions, just post on the group or just text me.
Thank you, Amar.
Thank you, Amar. Amar, have you put the slide for the TB one and the hypercalcemia one cases?
You will find, yeah, there is hypercalcemia case and TB case in the respiratory. Yeah, TB in the respiratory.
In the respiratory.
Yes.
Okay. Thank you so much. Thank you so much.
Yeah, thanks.
Thank you.
Welcome, guys. Thank you.